Hi, my name is Chris Centeno. I'm a world expert in regenerative medicine, and I'd like to take a few minutes of your time to help you understand all the confusing things you've heard about stem cells. Way back in 2005, myself and my partner John Schultz were the first human beings on Earth to treat common orthopedic conditions like knee and hip arthritis, as well as low back degenerative disc disease and shoulder rotator cuff tears with stem cell injections. And since then, we've published more scientific data on the clinical use of stem cell injections to treat these problems than any other author worldwide. Those are our publications to date, and each one of those takes months to do. Our Colorado clinic staff has trained physicians in regenerative medicine from all of these prestigious universities, meaning that we've trained physicians who are from as far away as Stanford to Baylor College of Medicine, University of Michigan, you name it, we've trained those physicians. More than half our patients don't come from Colorado, and this is where they've come from so far. Each one of those dots is where we've treated a patient who has traveled from there to Colorado. And we see patients from all over the world. This is where they've come from outside the U.S. to Colorado so far. So unlike others out there, when I say I'm an expert, I can back that statement up 100 times over. So right now, we have the following types of clinics out there. We've got the chiropractic, naturopath, acupuncture clinics delivering fake stem cell treatments through an injection of dead amniotic or cord blood products. We've got the magic IV clinics that are putting stem cells in intravenously. We've got offices performing blind injections. We've got those who try to use only ultrasound. We've got clinics using fat stem cells and little bedside machine clinics. So let's go over all this stuff. So you've probably heard we have vials containing millions of live stem cells. Regrettably, that's a scam. Their products have no living cells at all. These are dead tissue products. In fact, they're regulated by the FDA to be dead, non-viable tissue. And we have a university-level equipped lab here in our Colorado practice where we've tested these products for viability. Because if they really had millions of live stem cells, we'd be using them. You can buy these all over the place. Your stem cells work just fine. They're not too old because if they didn't, your body would only last a few weeks. That's what happens when your stem cells don't work. And you've probably seen clinics out there claiming to regrow you a new knee if you've got severe arthritis. This is an x-ray trick. I did it here. You can see the x-ray on the top shows very little space. The x-ray on the bottom shows more space. That's my knee. I have no arthritis. I just tilted the beam a little bit to either create space between the bones or get rid of space between the bones. So this doesn't happen with stem cells. Now there are other things that we can do with your knee that will help your function and your pain, but we're not going to regrow you a new knee. We've published on this many, many times, and this is a scam if you have seen it. Stem cells find their way to where they're needed. 97% of stem cells injected IV will end up in your lungs. It's called a pulmonary first pass. They won't do much good for your knee in your lungs, and blind injections without guidance may not be in the joint at all, so you paid big bucks for nothing. Fat has more stem cells. This is a fourth grade math error. When you add up all of the stem cells in bone marrow, which is what we use, and fat, it's about the same. It's 6 of one, half dozen of the other, as my father used to say. Multiple research studies show that stem cells in bone marrow are better for orthopedic uses, and that's why we use them. We will use some fat stem cell procedures from time to time when we believe they're needed. Liposuction is less invasive. That's not true. Based on large research studies, liposuction is about 100 to 1,000 times more invasive than a bone marrow aspiration procedure. Picture this. To perform a liposuction, I, as the doctor, and I do these because we'll do and use some fat from time to time, I have to liquefy your structural fat tissue in the body with, quote, elbow grease so it can be sucked out. That's dramatically more invasive than a bone marrow aspiration where I put something through the bone and I pull out what looks like thick blood, basically a fancy blood draw. We have a lot of clinics just injecting some stuff inside the knee or hip joint and calling it good. We inject instead specific structures inside these joints that may be damaged. That's a lot harder to do. And in fact, it's not something the average orthopedic surgeon, physical medicine rehab doctor, or interventional spine doctor has been trained to do. It's certainly not something that a nurse has been trained to do. And it requires highly specialized training that involves both fluoroscopy and ultrasound. Another thing I've heard out there is that we only use ultrasound because the x-rays of a fluoroscopy unit can kill stem cells. Not true. We've actually tested this in our university-equipped lab. There were no issues with using x-rays. To do this work right, you need both fluoroscopy and ultrasound. Most clinics don't do that because it's much, much more expensive for the office. It's about 3 times as much to use x-ray as it is ultrasound. And one works better for certain injections than the other and vice versa. Our bedside machine is the best, meaning that pretty much any clinic out there you see uses a little bedside machine. It's not real sophisticated. Instead, we use a flexible lab platform, meaning we have a real lab where we process all this stuff. Little bedside machines produce far fewer stem cells in our flexible lab platform. And they're all one-size-fits-all devices and can't custom tailor your cells to your needs. They don't know the dose either, meaning that when you get stuff out of this machine, you don't have any idea how many cells you have. In no other area of medicine is it okay to inject something into someone's body where you don't know what it is you're injecting, meaning that these folks don't count the cells when they come out of these little machines. We do, so we know the dose and we know how much we can inject or how much we shouldn't inject to get the best results. So in summary, we invented this space. We continue to be world leaders. People travel from across the world to be seen here for orthopedic stem cell injections. And don't settle for some clinic who learned from someone, who learned from someone, who learned from someone, who learned from us. Actually, just go to the source. And what we do is far more advanced than everyone else out there. So thanks so much for listening, and I hope I educated you about what's going on in this space with the craziness of stem cells and all the different things you hear.